Good evening, viewers. Welcome to another episode of Health Link, brought to you in the studios of QTV by myself, Dr. Shamila Jah, and my co-host, Maria Masane. I think it will be apt to tell our viewers that from henceforth, all our programs will be on coronavirus until further notice. On Wednesday, we heard the Director General of WHO declaring the outbreak as a pandemic. Today we have more than 132,000 confirmed cases worldwide across 123 countries. We know that for most of you out there, there's a lot of fear, there's a lot of concern, and there's a lot of fake information also that is being spread. So today we want to address some of these concerns. And to do that, we have brought into the studio with us two experts. And we will be discussing a lot of things. We'll be discussing what exactly a pandemic is, what implication does the statement on the 11th of March by the DG has on us as a country, what can we do as individuals to prevent ourselves from getting the infection, and how to prevent other people from getting it, and also what the Ministry of Health is doing, especially with this new information and the way things are evolving. As all of you are also aware, this is a rapidly changing outbreak. Things are changing by the minute, and new information will be coming out. And we want to assure our audiences that we'll keep you updated every week on what is happening and what are the new things that are coming out. For our Wolof and Mandinka viewers, this is to assure you that we are going to translate our discussion into these languages, so please stay tuned. Before we start our discussion with our expert, I will allow Mariama to translate. Mariama?
Assalamu alaikum badin Gambian ko lanin jubirlal mbal konton na kabo QTV telebumbato kafali ko aldi ma Mariama Sane aning Dr. Bafon Dr. Shamila Jah wala beshirin ale jam puruka la nyin jata kende akacha kale komin ndalta ka kale nyami ndorong lokun ka jata kende akacha natale jata kende afanna bunnabe bari kabring a lokun tambila an nyabe tilindin kacha kale ndoron ne la nkuran killing mi yalon kay dunia be jakalle ama mol hakilul manten kun ko teke silo siata am dunia kono ami ka foku ko coronavirus ka fight COVID-19 niaje dung silang ba fala mole le komin na nyin kacha to mal minil be na la fo janni nyin kurango be suma yala dunia kono be tulate do ne kacha la mole pour mol salon mimu nyin kurango ti handi kabi fanang ning atara ya soto be minekela anung ning atara ma soto fanang be silol minita la pour ke fango ma koy isaje nyin kurango kana wajabi dunia kono aroba tambila WHO mi alon ko ka fo bungalo mi alon ka tele marta dunia a jata kende abunda karobela yaji ko nyin kurango say nga futata tembe dal la mi yalon ko a wajabitale ama kurango nyin say nga jawyata dunia ko nele wala tini tubabul ka fo nyamin pandemic yewo tole di ala sang bari atata le fo sila nga tambite bulu kono bido nga luntangol le soto jamminil yalon ko nga fo ko itolla du ko nyatlinte nyin doronella do bota man sakunda le to ndo fana bota nyin do bulu ci obungale to bari janning bi itandila ko teke pour niye ka cha continue ambe ka cha sindila Dr. Shamila la mbaka telefona ngake surwa kamala assalamu alaikum mboki Gambiani suma all of visatu dal way dina try pour ma translator len nga gis ñepp ñu mëna understand lan lañ ka di waxtane fi tay comme niñ leen ko waxé rek last week suñ waxtaan bi dafa jublu coronavirus mo nek febar bo xamne mu ngi ci aduna bi mu ngi jaxle nit ñi yang ci ragal nit ñi seen xel bi nekatuñ suñ bopa dal febar ba ngi wër aduna bi yépp motax ñu gëm ne dafa am solo torop pour ñu tok fi fu mu ne ni dinañ nekk diko waxtane be bala ñuy xamne febar bi wañi na ci aduna bi mbaate génn na ci aduna bi comme niñ leen ko waxé rek dañ fi am ay gan yi nga xamne tay suñ waxtaan be ñoom dina nekk dina jublu ci walum febar bi waye bala may wax gan yi lan lañ fi ñëwé dina delu waxtaan bi ci Dr. Shamila waye comme ni ngeen ma déggé moko ci soosé WHO Wednesday bi passé ni waxon nañ ne febar bi légui dafa ëpp loxo ci aduna bi légui ëpp na loxo be ñoom ñu ngi wax ne légui comme pandémique la febar bo xamné légui mom daanaka ëpp na loxo be kenn xamatut naka ngay def aduna bi yëpp ñëppa ngi ragal motax nak ñu fogg ne dafa am solo torop pour ñu tok fi semaine bu nekk suñu leen isilé health ring rek pour ñu waxtané yëfi febar bi kon dina delu waxtaan bi ci Dr. Shamila pour ñu gëna continuer Dr. Shamila.
Thank you very much, Mariama. So our guest today is he's not new to the program. He is Dr. Desta Tirune, the WHO representative to the Gambia. Thank you so much, Dr. Desta, for coming again on our program. So we had on Wednesday the Director General of WHO declaring the outbreak as a pandemic. And simultaneously, the level of anxiety and panic in the society has also gone up many folds. What does the meaning of pandemic, what does it mean? How can we explain it to everyone?
Thank you very much, first of all, for inviting me to this program again. What pandemic means is actually, in simple terms, the disease has spread to many countries around the world. It's widely distributed. That's what it means. But in terms of the severity of the illness, or in terms of the strategies that we use to contain the spread of the disease, there's nothing changing. Countries should continue doing what they have been advised to do, and our containment measures should continue even at much more stronger pace, because part of the reason why we are having a pandemic is because many countries were not really following the advice strictly, and were not putting some preventive measures in place, and the preparedness was not to the level that was required. So what this emphasizes is that the disease is widespread all over the world, so you can get it from anywhere in the world. Initially it was China, but now any country in the world is susceptible to get it. Even those countries that are not reporting confirmed cases are very few now. And even in the African continent we have about 12 countries who came on board with a confirmed case of COVID-19. And this shows us that anytime the disease can spread also to those countries that are not yet affected. But for that, what we need to do is prepare more and strengthen our surveillance system and contain the first case that we are seeing as soon as possible, and identify the contacts of the first case and make sure that it's not spreading within the country. This is what the emphasis is. Otherwise, in terms of what we are supposed to do as individual countries, the advice remains the same all over the world.
Okay,
Thank you.
That is very reassuring, because Dr. Desta, when they said it's a pandemic, people were really afraid. They were thinking that is it, everybody will get it and there is nothing we can do about it. But from what you are telling us, it means pandemic is just the spread of the disease, but does not necessarily the severity of the disease. The disease is not as severe as it was yesterday or day before yesterday. The severity is the same. It's just that it has spread more. So I hope with this information, Mariama, our viewers will be rest assured that really pandemic doesn't translate into something that they need to really worry about.
Sure.
Yes.
Badingol coming aliye Dr. Shamila moy dorong ay Dr. Daxta nyen kamen na walem nyin kurang coming to babol ya fanya min pandemic ay nyin kala ni ko pandemic mun pandemic ti aya fay ko womu kulete mi ya lon ko kuran coming sign futata kurang otole coming ngafa le nyamin dorong atatale fo sign kurang wajabitale bulo tambitale wala tina ni ko pandemic dorong ka sutiandi dorong walam bari ni ko pandemic fana man yitandi ko coming kurang nyin handikabi coming a garawta nu nyaming ala garawo la fata coming wala nyama saying ate hanika bi ate o kuran kilingolem aba nya kilingole nyama bari coming saying a tambita le doronga siata dunia be kono le selang akamunda ko banko almost dana ke be ya sotole ya fo nyaming ko coming naning africa banko banku tang aning fulawol be ye fon itandile ko e mo sotole mi alon ko e nyin kurango sotole ako woto manjari ngasila nyanta kaminke doron wolon coming itole yamarol minidi ngatuwa yamarol kandorong ye fewo fen ko pour mol ya ke dorom pour isaje nyin ku don ning atara soto ta banko kan wara hana man soto je isaje nsem fangolon stati lo min nan sa wolon ning atara soto ta fanan mol se fangol ma ko nyaming pour courant nyin kanal sawun dula dol to ning atara man soto fanan nga kata hani kabi doron ye nyin ya marol min fonga tunyi ya marol kan isaje nsem fango soto no ngam fango tankano nyin courant wala mbokay comme li ngeen dige Dr. Shamila mu lecte Dr. Dexter comme biñ commencé programme rek waxon nañ ne WHO waxoon nañ ne aralba bu passé ni feebar bi tollu na foo xam ne léegi ñoom ñu ngi wax ne pandémique la comme lim laajte docteur Dexter mooy suñ ne pandémique rek lan mooy pandémique maanaam moo nekk ne feebar bi léegi dafa law si àdduna bi daanaka dëkk yëpp dëkk yu bari am nañ ko waaye comme nim meloon feebar bi nekkul ne comme dafa gën a garaaw feebar bi ba tey noonu la mel moom lim advice nañu mooy ñu continuer di def liñ war a def rek comme ñoom advice biñ nekk di jox dëkk yëpp ñu toppat di advice boobu noonu su fekkee ne amuñ ko ñu ne ñu jaar yoon bi ñu jël yoon boobu noonu nga gis ñu mun a protect suñ boppa su fekkee ne tamit nit ñi am nañ ko tamit liñ war a yoon bi ñu war a jël ñu fexe jël yoon yooyu noonu nga gis su fekkee ne mu ngi ci réew mi ñu mun koo contain daal benn place nga gis feebar bi du law gën a law muy gën a ci dëkk bi kon docteur Dexter loolu la wax ne suñu ne pandémique rek loolu la ci gàttal docteur Shamila.
Thank you very much. So, Dr. Dexter, you mentioned that our strategy has not changed because just because it's a pandemic. We just want to reinforce the same messages to our audience, which is the preventive measures. So, how can someone protect themselves from getting COVID-19?
Okay, that's very, very important. That's what the public should know. Mm-hmm. As we know, the disease is spreading through breathing from the person who is affected. And it's transmitted just like any other flu and common cold that we know commonly. And this is through sneezing and coughing. During sneezing and coughing, there are small drops that are not usually visible that will come out of the mouth and nose of the person who is sneezing or coughing. And these are the ones that may directly be transmitted, inhaled by the person who is not affected. This is one way. The other way is actually when the person is sneezing and coughing, or someone may not be in contact with the person directly, but these droplets may just land on surfaces like tables, hand knobs, even cell phones that we use. We shake hands. Through these droplets can be easily passed to a person. And that person who touched these surfaces that are contaminated with the virus, then if this hand is coming into contact with eyes, nose, and mouth, where the soft tissues are, that's how you get the disease transferred into the person who is not affected. This is a common route of transmission. So for this, to cut this transmission, what people should do is, as a matter of discipline, they have to wash their hands with soap and water. We'll be demonstrating maybe later how to do it. We have to spend a minimum of about 20 seconds. That's almost roughly like singing happy birthday for 2 times, happy birthday. That period we have to be washing, and we will show it how to do it later on. And if we do that regularly, then we'll be able to kill the viruses that are in our hands that are contaminated. Even if we touch our mouth and nose after that, then the virus will not be transmitted to the person. So this is one of the most important measures that we have to adopt. The other habit that is very difficult to stop is touching nose, mouth, and eyes by hand. That's a very difficult habit to stop, but people will have we have to try to avoid that as much as possible. It's not only for this disease. It will protect us from all respiratory illnesses, which is the seasonal flu, common cold, anything that's transmitted through respiratory route. We can prevent it through these ways. So, and when you are also, if you have cough or sneezing, once you have the illness, you have to make sure that you cover your mouth with either soft tissue or handkerchief or any material that can cover your mouth, or use the corner of your elbows to protect the droplets from coming far from you. The third one, which is very, very important, is actually to keep distance from people who are coughing. A minimum of 1 meter distance. If it is farther, better. And that's very, very useful, because the droplets that are coming out of the mouth of the person who's coughing or sneezing will not go very far. They will just be dropping on the surface around 1 meter distance. So if you are standing out 1 meter and above from the person, you are very unlikely to get any of these droplets coming to you. So that will probably protect also us from getting this disease. So 3 things: washing hands, keeping the cough etiquette, which is covering your mouth and nose when you are sneezing or coughing, and also keeping a distance from the person that is coughing. And if you have also a person who has traveled recently to countries that are affected, please, for the sake of your family, you have to report to the health facilities, because this will protect you and your family members. Usually what we find with this disease is actually, if a person is infected in one of the members is infected, the disease usually is transmitted within the family with close contact, because we are always close to each other when we are eating, when we are even shaking hands or hugging each other. We are close to each other, or taking care of a person who is sick. Will come very close to each other, and that allows the disease to be transmitted from person to person. So it's for the family's sake and for your own sake that you have to report when you have this case, situation. If you have fever, cough, or shortness of breath, or weakness, some tiredness that you feel unusually, then this could be probably this disease. So it's always good to report to the health facilities, and there's a number that's already actually toll-free. You don't pay anything for it. It's 1025. Call that number and you will be advised to do the right thing, and that will really help to prevent the transmission of the disease in the family and others around you.
Thank you very much, Dr. Desta. And I think that is very important, especially for us in the Gambia, where we don't yet have a case. So if we are all very careful and we are vigilant and follow all the instructions that the Ministry of Health is telling us, we'll be able to contain. If we report ourselves quickly, we will really be able to contain and not allow it to spread like it has in other countries. Mariam,
mbadingol coming ale Dr. Desta mo nyamin doranga kamin fo am Dr. Shamila ya nyidin ka nyin kura ko mo se fongo tanka no wala nyadil aya folo ko ka fo nyin kura mo kura ne te mi ya lonko am sawun kura lem adun aka sawun nyamin dum wala ning atara mobe totola komin daji mesongol min ka finti toto kono sa ken nyalta jelano badu wadaji ko no nyin jankaro ka tara wadaji lo kono adun ning atara wadaji tata fay dulama adrong momo na te bulo e dulama adrong o kura nyin sa sawundi no molal adun ning mol fanang minel be dal hani ka bi doron ning atara fanang imariti sota komi nga fanya mate nyen ku kilengolong daji mesongol minil ya lonko ise bono da kono kata bulul kan warata bulul kan wara dawda drong ibe dawda oto nyin ku ron se nyin jankaro se tuno jele adun momo na taw ma fanga dre bulul la o fengol kan drong imari be nyin ku ron so tala nole ay ya maro du ko coming be silol minita la pour ka nyin fanga tanka nyin ku ron wala kom wato wati drong nga kata kam buloku ako nyoto domandi drong aba itandi la mulale buluku nyambe minkela adun be wofana itandi la le bari buluku nga osiandi bake aning safuno nga safuno ta wato wati drong nga kata nga bulol ku drong faye sene ya janning anka ku woku ma wara janning ka fe wo fenke afula njango dum fana nga ko wokko la yata bakele bari nga kata nga bulana baluwo kono wolon kan fonyo kan nyalma wara kan nungol ma kan dalma surtout nim bulol man tara sene yaring ako ning atara nga woke drong be mfongo tankalo nole bayri nyaning daning nungo silole bije minil ya lonko itolle be nijiyo karo ma fongo la balu kon woto ning an kata nga kata drong nga bulu nga fonyo kan nyal nim nungol ma drong mba kata la bakele pour ka nyin kurango dandi dula killing hani ka bi drong ako ninga tara fana ning momo be tisola wari momo be totola isa kata ning atara tissue be bulu tissue paper be bulu wara funto be bulu ya kata yewo ke dato isa je fewo fen ka finti drong abebe tala wala kan ni pare karita ya lampi kuke ya kem nyama mbalito kono mi ya lon ko is at most bulote mala noji wara ye bulu kango tateng ye toto keje wara ye tiso keje ninga woke doron bayri mol bu katariya ka je ma doron ako ning atara nga wasilol ta doron mbem fango tankala no nyin kurango lale adum fana ning atara mo fana mbe mi ya lon ko ye nyin kurango sotale ako yaje ko ibalo ka kandile mi kungo ke dimi adungi mi ka to ware kankono to kedimi yakata ye coming jata kende abunda karola ko 1025 nga fale nu nyamin dorong e wallahi no bije lebu ka hani butut jeje ni je ko man dorong isulata ma koy romina ibina babe dile laje ninga tara fana yijo isobite fonga la coming ye nyin courant soto yakata bake ye jamfa mol lay ni mol kana sutia ako hani meter killing way tara ko ning atara nga oken ni mol tema dorong coming ite courant soto pour ka sa wundi dola obe ko le ala le wota ko nyin silol le bije nyanta kaminilta pour kam fango ma koy kam fango tanka nyin kurangala mbokay comme ni ngeen déggee docteur Desta li ko docteur Chamie la laajte rek naka lañ mun a yan yoon lañ war a jël pour ñu mun a protect suñ boppa si feebar bi lim njëkk a wax mooy feebar bi dafa nekk feebar waale te niñ ko mun a amee mooy su fekkee ne nit dafa saxat am na ay tufli yu ndaw nga xam ne dañoo génn ci gémmiñ bi te tufli yooyu noonu dañoo am jàngoro bi ci biir te jàngoro boobu su demee fu mu mun di laal rek ku fa ñëw nga laal foofu noonu am nga am yoon pour nga am feebar bi léegi lim ñu gën a advice mooy waxtu bu nekk rek saa yu nekk ñu jël saabu am saabu ak ndox ñuy raxas suñ loxo yi ba mu set mu ne ci kanam tuuti dinañ leen woon naka ngeen mun a raxasee seen loxo pour ngeen mun a protect seen boppa si feebar bi ñaareel ba mooy kuy mun di saxat rek mate kuy mun di ma tisooli nga fexe am tissue paper mbaa nga am morceau boo xam ne soo ci tisooli ba pare nga def ko ci sa gémmiñ bi mbaate ci bakken bi rek soo paree nga jël ko nga defar ko bu baax nga sànni ko si mbalit bi mbalit boo xam ne nit yi kenn du ko mën a gaaw a jot bu ko defee tamit ngeen jël seen loxo bi nii banka ko ngeen tisooli foofu noonu mbaate ngeen saxat foofu noonu ngeen gis li génn ci gémmiñ bi mbaa ci bakken bi rek yëpp dina dem foofu noonu parce que boor boobu noonu dafa nekk boor boo xam ne nit ñi duñ fa gaaw a jot kon yoon yooyu noonu mu ne su fekkee ne jël nañ ko rek dinañ mun a protect suñ boppa te mu ne tamit ku gis sa yaram bi mu ngi tànga nga gis ne yaa ngi soj sa boppa bi di métti mu ne ngeen fexe ngeen call 1025 mbaate lopitaan bi leen gën a jege pour soo leen eggee foofu ñu mun leen a dimbale pour ñu protect yoo si jàngoro bi ak ñëpp ñi la jege mu ne tamit su fekkee ne tamit am nañ bokka yoo xam ne ñoo xam ne dañ jógee ci réew yoo xam ne am nañ feebar bi bu ñëwee rek ñu fexe ñu wax leen wax ñi ñu war a wax nga gis feebar bi ñu mun leen a monitor nga gis ñu ñàkk a waale feebar bi su fekkee ne ñëwaale nañ ak feebar bi tamit mu ne kuy saxat nag tamit nga fexe benn meetar nga def ko ci diggante yow ak nit ñi nga gis lii génn ci gémmiñ bi rek du mun a gaaw a dem ci keneen kon yoon yi la wax pour su fekkee ne ñu jël ko ñu fexe tamit nag am na yoon buñ nag ñu bàyyi di laal suñ bët yi suñ bakken yi ak suñ gémmiñ yi parce que lépp lu laal loxo bi rek ci jàngoro bi dafa gaaw a dugg ci yaram bi ci boor yi yaram cër yi ñu wax nii kon ñu bàyyi xel bu baax ñu raxas suñ loxo yi ñu bàyyi di laal suñ bët yi ak suñ bakken yi su fekkee ne suñ loxo yi satuñ su fekkee ne yëg nañ feebar bi ay comme yaram yu tànga yi ñu fexe ñu call 1025 mbaate ñu dem si lopitaan ñu gën a jege kon docteur Dexter lii la wax si gàttal ne lii lañ war a jël pour ñu mun a protect suñu boppa si feebar bi docteur Chamie.
Thank you very much, Mariama. Hand washing is a very important way of preventing coronavirus, and Dr. Desta will demonstrate how to do the hand washing, the right way of doing it, and the right duration. So, Dr. Desta, over to you.
Okay, let's do it.
Yes. So, as you can see, viewers, here we have the local soap. It's just the normal soap. Just for everyone to know that any soap that you have, it's effective against the virus. As long as when you are washing it, you allow it to form or lather. He will demonstrate that.
So the first thing that we do is actually, if we have a very heavily soiled hand, we first have to wash it with water only so that we can reduce the amount of soil on it. But my hand is not soiled, so I will go straight to the demonstration of how to wash hands. And this is a common soap that we can find everywhere in town. And we are using this because this is a common one that is found. So the first thing that we do is actually we wet our hand, and then first we have to apply the soap, enough soap on our hands, Then once we have enough, then we have to make sure that it spreads very well. And after this, what we need to do is actually we start from the back of the left hand, using the right hand.
Dr. Zesta, should I sing happy birthday?
Yes, we can say
Okay.
that. Yeah.
Happy birthday to you.
We do the same
Happy
on this side.
birthday to you. Happy birthday
Then we do
to
the same
Dr.
from the
Desta.
inside.
Happy birthday to you. So
Then
that's one
we-
happy birthday.
We do this.
Happy birthday
this.
to you.
This is for
Happy
the
birthday
fingertips.
to you. Happy birthday to
Then-
you, Mariama. Happy birthday to
Then
you.
we do this approximately. Now we have touched all parts of the hand. Now we are ready to rinse it.
Wow, so the technique is very detailed. So there's not a single part of your hand that has not
all,
been,
yeah.
that you didn't rub properly, including your fingertips.
Yes. I think that's fine. I have not washed up, but if it was, I think, exposed, I should have washed even up to here, so
Okay.
that all the parts of the hand is clean. Then after that, we just dry it up, and we are done with the process. Now this is clean hand.
Clean hands.
If there was a virus on my hand, it's already killed and removed. So if I touch my face after this time, it's much safer for me. I will not get the disease transmitted if it was, even if the hand was contaminated with a virus. So that's what
Fantastic.
what it is. Thank you.
Mariama, you might want to translate that for our
Yes,
viewers.
definitely. Madingol pala murunta nanjang kote ke mbota break la Dr. Dexter mingi tandi doron komi ngafali nyaming buluku olem ngafali buluku kumaya batale adungali aje akum sula ta fen mam sula fen min siyata fang nyimu safunol te mi alon ka soto so ne yata bitikol konole itata dawda doron isa soto no jele nyimu jole ti ji sene yari ngomi alon ko o fanan soto so ne yata banko kanne al sula ta kufula doron la wolom safunoti aning jio ninga talbe so fanan kono pompol bijela al se woltano le pour kal buluku ninga tara bulo nota bakele oto ako ayali amar folo ali bulo sanan kudo manding folo aning jio la fay fo no ye talaje o kola alsina safunota nga safuno tirtirim bulo kono fo ngaje ko sain safuno siyata bulo kono le o kola le safuno landi ako ali akumasi ka bulu ba bulu kandingol ali wota ka bulu mara bulu kandingol ku ka temal ku fay ka susa fay sene ya anim bulu kango ali mbo woto ali mara fananta ali bulu ba fanan ku wala fo ay fali futa ali abeben nal bota woto akal sina ali bulu tete kono kuteng o kamuntale ko bulu kandingol belol bebe ku kanne saing ali wol be tiri ali fanan murung bulu bakang ali o fanan ke kaje fanan tiri fo isaje ngon singol ning no one wobe ngon singo kono dron aninga be bulu kangol dron o be fanan se bondi no jele ningal pareta komi nga fala nyamin happy birthday dron albe wole dala Dr. Shamila fela ya lanya jang ali bulu be ku teng fali ya be ben ko maning duma ka be ku akon ning atara fanan ala dendi ko man jam fanu abe jel be ku lale fo santo jang ning atara ali wol be ke dron ali aje ko sain safuno e dula be benne wokola ali ji sene yari ngota kal bulo sananku ali aje ay tissue paper tale aya bulo be fita biringa pareta ma fay duma de atata lay nyama balito la nyini aya fay je akon ning atara komin jankaro few fembe bulo bala doron oto safuno ya be fale say nga bulo sene atale isaje asa nyaaw ning abulo man wala woto nyinom bulu koti ay nyin silo le tandi yalla mbokay comme ni ngeen gisee Dr. Dexter li lam ñu won moy raxas loxo ba mu ne mom yu raxas loxo ba soxluñ dara lu reey fofu nonu liñ fa soxla moy saabu te saabu bi so demee bitik bu nekk rek mun nga koo am ak ndox bu set gis nga suñ booli ndox bu set bi ak suñ siyo bi su fekkee ne tamit yéen a ngi ci kër am ngeen fa pompe jarul ngeen ut root ndox si bool mun ngeen a ubbi pompe bi rek ak seen saabu bi lim njëkk a def mooy mu ne su fekkee ne loxo bi dafa tilim torop foog ñu xala yalandi loxo bi ak ndox bu set pour ñu wàññi tilim bi bu boobu jeexee ñu jël saabu bi ñu jël def ko si suñ diggante loxo yi ñu beñ gis ne saabu bi léegi am na lu bari lu lekk si loxo bi ñu teg saabu bi nag ñu commencé suñ ndeyjoor bi ñu suñ loxo yi ñu dugal ko si diggante loxo yi ñu raxas foofu noonu ak gannaaw yi loxo bi bem set boo ko defee nga jëlati beneen loxo bi nga raxas beneen bi ci diggante loxo yi daal buñ ci fàtte ñu ko raxas ak raay ko ak ci gannaaw loxo bi noonu bu ko defee diggi loxo bi ñu jël suñ baaraam yi ñu raxas ko noonu ci digga bee nga xam ne cati baaraam yi sax ak weyi yëpp dinañ ko fa raxasaale ñu def boobu tamit ci beneen loxo bi bu ko defee nag ñu jël ñu doog a jël suñ loxo bi raay loxo ba yëpp nag bem saabu bi daj loxo yi yëpp ñu xam ne léegi ba ci kaw mu ne su fekkee ne boobu loxo bi guddutoon dina doon raxas ba ci kaw nga gis foofu noonu tamit su fekkee ne tilim tilim bu fa nekk rek yëpp dina fa génn buñ de gisee ne léegi saabu bi wër na loxo yi yëpp ñu jël suñ ndox bi ñu yàllandi suñ loxo ba bam set nag mu ne su fekkee ne jàngoro dafa nekkoon ci loxo ba rek kon jàngoro boobu yëpp dee na génn na si loxo bi bi ngeen gisee gis ngeen bi mu paree jëlut mbubaam o anything mu fompa loxo bi dafa jël tissue paper bu set mu fompa loxoom bi te bi mu ci paree nag jëlut mu saani ko ci suuf gis ngeen fi mu demee mu dem si mbalit bi mu saani ko foofu noonu ngir ñu continuer setal place ba rek waaye loolu lam ñu woon fii ni ñoo mën a raxasee suñ loxo yi te loolu yomba na trop te gëm nañ ne loolu yomba na doomi réew mi ñëpp dinañ mun a defee noonu seen loxo yi pour raxas ko Dr. Shamila.
Thank you very much. Dr. Desta, just regarding the treatment, there's a lot of information out there in the media, and people are talking about different kinds of remedies that they will usually use for cold. And the fear is, as we've seen in many countries, is when people decide to self-treat themselves with the remedies that they normally usually will work for cold, like taking ginger, taking garlic, taking so many things. Can you tell us what treatment is available for COVID-19 and what prospects are there for vaccine?
Yeah, this is the problem now in many places. There's a lot of information flowing in the social media, and these are information which are not founded on any evidence. So currently, from what we know up to now, we don't have any treatment or cure for coronavirus. So whatever you have heard from the social media or from other sources, there is nothing proven to be a treatment for this disease anywhere. No one has discovered anything. But at the same time, it's good to also know that WHO, in collaboration with many researchers around the world, is trying to actually find medicines and vaccines against this disease. And already, I think 4 vaccines are under trial and for testing. And but this is a slow process that will take time to come with a result. It has to be tested and verified before it comes for public use. So it may not be available in a very short time that we can see from now. So the only tool that we have now is the things that we have demonstrated: washing hands, keeping distance, trying to avoid also, shaking hands is another problem that I think people have problem with because of the tradition of greetings that we are used to. People have a problem of avoiding handshakes. If we cannot avoid handshakes, if we have to do it, then we have to make sure that after handshaking, we have to clean our hands as quickly as possible before we forget. Otherwise, we are going to expose ourselves for a possible chance of getting infected with this virus. And people who have developed the illness, initially, some of them may not show even some of the symptoms. So it's always good to be cautious. And the advice from WHO side is actually, as far as possible, try not to shake hands as much as possible. If you cannot avoid it, make sure that your hands are clean immediately after you do that. Okay. This is the advice we have. But concerning treatment and vaccines, there's nothing in the market which is made available and which is ready for use. And whatever you hear from different sources is not correct. You should not believe that, and get your information from the right sources. If there is a cure, Ministry of Health will announce openly, and this is a reliable source. You can check WHO websites, you can check UNICEF websites, you can check the Ministry of Health website. These are reliable sources that are giving you always very evidence-based, confirmed information, which is based on facts, not just rumors. So don't follow what is coming from social media. Follow the advices from official channels of reliable sources. That's my advice.
Thank you very much for clarifying that for us, because we've been seeing a lot of panic buying toilet paper running out in some countries. Other countries, they don't even have garlic. Everything is running out. People are buying. So it's very important, Mariama, that we inform our people that really, like Dr. Desta has said, there is no cure, and we just need to report as quickly as possible instead of doing self-treatment, so that our healthcare workers can take the best care of us. Yes.
Mbadingol coming Dr. Dexter min for Dr. Shamila anyini kamin na wolom mul ba fokan coming na gingerol ni na nyilajol min ya lon ko ke soto so konan ke sam marseto mul ko ni wal dol nyimi ama ke tanka nyin kurang soto wara ka nyin kurang ken yandile aya nyin kale fo nyin kurang dum a boro fintitala wara jara dunda fintitala mi ya lon ko aka nyin kurang jalan aya itandi ko do ko be ke kan ne kiskisi rol be ke kan ne bari hani kabi imam borije mi ya lon ko isa fo kay nyin kurango jalal oto nyin kurango bori teje min sa jara folo na manke nga silol mini fo pour molye wo silol ta ako wokola o fente je mi yalon ka fintita bari hani kabi doron comme nga yafa nyamin double e cho nyim bumba mi yalon ko e marta jata kende yalla dunya be kono ibe ye bulola dulal kan mini yalon ko e be nyin keskesiro ke kan hani kabi pour ka jibe fo boro be fintilal adun hani wobe kerim fanga ko janninga be fintila be watindin talale bayri keskesiril jamal le bije anin silol le bije ka jibe pour ama boro nyi finti woto molbe se hakilo tenkundu ko fanan amman boro soto bare ning atare yenyim bulukuwal fo aliyam e kamin fotem pour ngawake ngam fangol tanka nyinti so nyalla ngawasilol ta dorong akombe mfango tankala no nyin kurangolal bare hani kabi dorong ka mol landirndi mol mu ko ko fo dorong ko ay boro soto le bori teje ning atara boro finti ta doron denu num man sakunda ba falale denu num WHO ba falale alka nyin ki barol min lamoy denu ni ba falale bare nyin ku koten dol minil ka ko nyin bor ay courant ay boro sotale nsalon ko bori tije mboka yi comme lima don wax rek moy docteur Dasta lim don wax fi moy docteur Chamla daf ko laajte comme nit ñi ñu ngi wax ne ay laaj yeek jinjar yeek boko yeyé da ngay dafay faj feebar bi ma daf lay mucca ci feebar bi lim ko tontu moy feebar bi batay amangut faj ñu ngi def sen investigations ñu ngi ut sen findings ñu ngi def liñ wara def rek dal pour ñu ut garab pour feebar bi waye batay gisanguñ ben garab bi mëna faj feebar bi lu dut yoon yi ñu wax ñu jël pour ñu jël ko ñu mëna aar suñ boppa kon feebar bi amul faj nit yi lépp li ñu nekk di wax nii amul benn dégg ci foofu noonu ndik ba tey ñoom ñu ngaa ut ay faj pour feebar bi waaye ba tey amuñ ko ki bëgg a xam lu leer daal moom soo ko xoolee 1025 di nga ci mën a am waaye ba pare su fekkee ne tamit mu ne am na faj dëkk government bi dina ko annonceal nit ñi nga xam ne ñooñu duñ wax dara li nga xam ne amul ci réew mi o amul ci àdduna bi WHO yëpp ñu ngi fi mu ne ñooyu yëpp dinañ ñu wax ne feebar bi am na faj waaye fu mu ne nii nañ ñi xam ne amul faj ñu fexe ñu yoxas suñ loxoy comme niñ leen ko advisé ñuy xam naka la ñoo saxatee naka la ñooy tisoolee ak yoon yi ñu war a jël rek ak jéego yi ñu war a jël pour ñu mun a aar suñ boppa feebar bi te ñu xam ne lépp li nit ñuy wax yëfi laaj ba ak jinja yi loolu amut lu ci digga Dr. Shamila.
Thank you very much, Mariama. Thank you so much, Dr. Desta, for coming. Can you just tell us one key message, one last message that you would like to convey to the people? Your last message to them.
Yeah. The last message is actually to use official channels to get your information for anything related to this disease. The information sources that I mentioned is Ministry of Health, the WHO website, UNICEF website. These have very useful information that will be very useful for public to know. But if you don't have that even, just use official channels and ask health workers and call the toll-free number 1025, which will provide you with any information that you may require regarding this disease. That's my advice. In addition, please follow the advice of washing hands and the way I showed it. If you do that, it's not only for this virus, but for anything in life. There are many diseases that we'll avoid by doing this. Hand washing regularly. When you wash hands, when do you want to wash hands? They're very, very important. Anytime you go to the toilet, and back from toilet, you have to wash hands. Before eating, wash hands. If you have traveled through public transport, when you come out of it, try to wash hands. If you are going to work, before you doing anything, just wash your hands. When you go home, before you do anything at home, wash your hands. All this will protect yourself and others around you from getting any diseases, including the COVID-19, which is we are actually getting ready for. That's my message.
Thank you very much, Dr. Desta. So, Mariama, like he said, I think the key message he has given us is that we have to use the proper channels when we are trying to get more information, or when we are reporting any suspected case of COVID. So thank you very much, viewers, and we'll come back after a short break. Thank you. Viewers, welcome back from the break. We are here talking about coronavirus today. We just had a nice, very important discussion with Dr. Desta, and we are here with our second expert to tell us more about coronavirus. And he is also someone that is not new to the program. He's Dr. Mustafa Biteye, the Acting Director of Health Services. Thank you so much, Dr. Biteye, for coming. Dr. Biteye, just before we went on break, we were talking about treatment for corona. We asked Dr. Desta if there was treatment for corona, and he said there is no definitive treatment for corona. So now when patients come and report to the health facilities and they are positive for corona, what is available for them in the health service?
Well, thank you very much. So like Dr. Desta said, there is no definitive treatment. There is no drug yet that is known that is safe, that you can use, and is very efficient in killing the virus inside you and reaching the places that they are. But when they come, but just like the flu or the seasonal flu or the cold, if you give supportive treatment, they can outlive the virus and then they can survive. So like we give supportive care. So if they come to the hospital, they are having fever, they'll be given drugs to help reduce the fever. Okay. If they are having problems with electrolytes, that could be corrected. Okay. If they have kidney problems, then that could be corrected. Or if they have problem breathing, that's respiratory issues, then they can be helped with that to maintain their respiration till they outlive that period.
Wow, this is very important information, Mariama. So it means a lot can be done. So that's why it's so important to come to the hospital. And I'm sure antibiotics can be given also if there is an evidence of a bacterial infection on top of the flu.
Yes, so that's very important. The antibiotic is, like you said, it's not for the virus, but sometimes you can have secondary infection because of what we are using. You are bedridden, so we are putting a lot of pipes inside you and all, and because of that you may have secondary, because it's very invasive, so you can have secondary infection, and that could also be treated again with the right either antibiotics or antifungal, whatever is causing the secondary infection.
Okay, so this is very important, Mariama. Yeah, please go ahead.
Mbadingol coming nga fale nyamin ronga luntam fulade soto jang brin nata bobrek la fulanjang onata la adu ngadde du manke luntan tinyeng programme auto bring nyen courant ka cha commencer ta dorong ke la hajol be bulale kana si nyajam pour ning e ka nyen courant ka cha ami ka fay Dr. Biteye Dr. coming janning katanum break la be fukande no nyen courant mang jara rosoto bodite je min ka jara bari ya nyen ka fanan coming ning atara moy nyen courant soto mi tata l'hôpital to be mu ma ko le dile la no pour isaje ye fango soto no ka nyen courant bulo kon aya foko coming nga fo nyami boril tije bari coming ni yaji be nyen fresh ko lol menili alon kon ka soto wala comme ba sasati yalon ning atara ya soto do bije ka borol min dila pour ye fango mako pour ka balola sojarol min yaron ko ka courant wal kele pour ka wal bambandi balo kono woto atenyin sila kilingole bije mi yalon ko ka ku kilingole ke doron pour ke mako hani ka bi bodi tije bari mako ro bije le min yalon ni futata l'hôpital to ike wol dila le pour isaje nying jankaro min be balo kono ase mako je damanda man fo jannin jankaro nying ba fango bulala kafinti balo kono comme nga fo nyami virus mu kulati mi yalon ka katara balo kono fango le adun ninga tata fanyanta ka boji oto la ka boji bodi tije bari mako ro bije le ka taminin silol minila pour ka mol mako pour isaje ye fango soto ka nyin kurango ka bo nyin kurango bul moto mbe ka cha sentila docteur bitela pour aya fanin surwa ko la bayri na surwa mu bete
oh yeah ila surwa bete ya de baake so luñ da wax rek moy mu ngi lacc bu am solo mu ne su nekké ne feebar bi dal na nit ñu ne garab amut kon lu tax nit ñi dem si lopitaan ñu ne baax na sorop pour nit yi dem si lopitaan parce que am na njëriñ soo demee si lopitaan comme socc duñ amut garab bu nga xam ne suñ la ko joxee dinañ wax ne dina rey jàngoro bi sa biir bi waaye am na garab yu ñu laa jox yuy fan xatee comme léegi-léegi sa yaram bi tànga torop ñu jox la garab bu nga xam ne na seddal yaram bi léegi-léegi yaa ngi wuccu ñu jox la garab yu lay dimbale si wuccu léegi-léegi nokki bi jafeñ ñu jox la garab wala oxygène wala lu lay dimbale pour nokki bi baax léegi-léegi sa fu saw yi di jaar fu ñu koy defaree léegi-léegi loolu tamit am problème si feebar bi boobu tamit leen la jox garab léegi-léegi sa feebar bi dara rax si tamit nga am feebar bi sa yaram bi néew doole yeneen yu si rax neen la jox yeneen faj yu toppatoo yu si rax tamit ba yow sa yaram bi am doole ba bu na génnee faj ko yow nag ñu door la nga tane incha allah léegi-léegi tamit ñaaka doo dee mun a lekka sax ñu jox la lekka bi si say ndox comme ndox parce que mun loo lekk mun loo naan sa yaa ngi am soo turóot yaa ngi am wanaasu ay yooyu so loolu tax dafa baax nga ñëw lopitaan pour ñu mun laa dimbala.
Thank you very much, Dr. Biteye, for that. I think another interesting thing that I think we talked about that we are going to discuss is we're seeing a lot of cases spreading all over. What is the ministry doing? What can you tell us? Like it's like the updates that are happening with the new scenario that we are seeing. Just recently, the government has made a pronouncement to ensure that, just to show example, that even within the public service now, they are not encouraging any travels outside. And we think that the public will learn from that. And so we want the public to cooperate more, because there will be more advices coming to involve the general public, maybe to involve also the religious leaders for religious gatherings and all. So as the disease evolve, more advice will come from the ministry. While luñ gëna xam mooy ne feebar bi nu mu gëna demee ñu si gëna xam di gëna jàng yeneen digle dina ñëw am sure yuy wan nit yi ne nu ñu war a jaar te yëpp suñ ñëwee rek na ko nit yi nangu jàppale ñu pour ndax ñu mun a fanxa feebar bi loolu moo am solo. Okay. Another thing that we see a lot of in social media is people saying that coronavirus even if it comes to the Gambia, the virus will not survive because it's of the heat. So we just want you to clarify that for us. How can the virus spread in certain conditions? So like warm climate, what is the expert's view on that? So
there's no evidence to show that the virus doesn't spread when in tropical areas like these very hot areas. There's no evidence to show that. But why people are saying that, they base it on some other reasons. Because the viruses that are similar to this one, like the seasonal flu, they are noticed to be more transmissible during the cold season and not as much transmissible maybe, but it's still transmissible during the hot season. So because of that, it has been extended to this one, but it's not based on evidence. With more research and more evidence, but as of now, what we know is we should make preparations. We all believe that it is going to be transmissible here. We've seen it in Senegal. We've seen it in many places in Africa. So we believe that it's transmissible in hot area. And now it's very hot around this area. And it's been there. You can see some local transmission even within Africa. So we are going to take it very serious that it can transmit locally, it can transmit when it's hot, and we take all the preparation necessary.
I think that's a very important information. Otherwise, people may just believe that and then they may relax. Thank you, Mariam.
Madingol coming Dr. Shamila kukuma bale nyinin kajang bayri ndefango bidu kudula adu ngamol muy ka foko atinano jam bayri jang kanditale wata kuma ya batale coming kamin foteng pour alsal hakilo tuje bake aya nyinin ka ko mol ko nyin jankaru abuka baluno kando kono aya itandi ko seke mi atini ka fo bayri niya jibe nyimba sasa a jankaro nyin pour ay sawundo la kasiya suma yalla kon ako bari kute kede min to nyaata ko nyin jankaro abuka sawuno courant kono wara abuka baluno kando kono bayri abe bankol to lamini ya lonko nyin afrika banko kamini ya lonko e kanditale ndala jam fango fele senegal fana be kandirin adu hani kabi ngalonko nyin courant bi jele woto ngawbon ning hakilo kono ko kafo ko abuka sawun wara abuka balu kando kono bayri kuti je mi ya woytandi ngakata dorong ngam fangol parindi ngakata nganyi yamarol min di dorong ngatama o yamarol la pour ngam fango mako e bari kafo ko abuka balu kando kono wo fente je mi ya wo sembentu ya afolo bari kiskisirol be ke kan naseke ninga tara obe sota lamba fola mole la bari hani kabi dorong woman soto follow doctor
so comme niñ ko don waxe mu ne jangaro be ñu bari ñu ngi wax ne du mëna dunda si place nga dañ tanga comme Africa fi comme suñ sow fuñ dekani Gambie waye luñ wax rek moy ne lolu amaguñ dalil bu wane ne dega lolu lu sahara so lu xew daal mooy ne lii luñ gis mooy biir Sénégal Côte d'Ivoire Burkina Faso Ghana dëkk yëpp dañ tànga te ñu ngi ko fa am so ñun luñ jàppa fii mooy ne pour ñu fagaru mooy ne lii dafay mun a wàlle dina mun a dunda bu baax si dëkk yu tànga te moo tax dañu war a jël préparation ñun ñëpp loolu leen war a jàpp gëm parce que amuñ benn mandarga o dalil buy wane ne lii duy mun a wàlle o duy mun a dunda si place yu tànga so
Thank you so much, Dr. Biteye. Do you have a last message for our viewers?
waaw comme lu ñu doon wax rek ak lu fi docteur Desta def lu mu wane raxasu bi loxo bi moo gën a important moo gën a am solo loxo bi su tëjoo rek da nga gis ne dara du dugga dara du eega si fen de so nay set rek nay loxo bi di set loolu mooy number one thing leneen lu ñoo wax ne na ñëpp kaam na ñëpp xam ne nguur gi ñu ngay def luñ mun pour def ne lii dara bu mu fi dugga incha allah so ñu ngay dëgëral place yi ñu ngay def ñu ngay prépare suñu lopitaan yi ñu ngay jàngal nit yi di leen train and ñëpp incha allah pour ñu seet ne nga xam ne su fi duggee rek nañ ko mun a fanxa ba bu mu dem fu sori incha allah.
Okay, can translate that for them and then I will rank.
Mbadi ngola coming na Dr. Bitela kuma labang momenti wolom nga kata nga buluko sendi na kuwo kono ako fengo be mu buluko le tidorong nga kata ninka bulol ku wato wati bulo itara senayari ndorong ako puru fengo e bulo bala kata balu kono ako be kole ala bakele nga kata nga wasiendi na balu na kebarul kono nyi wati kono nga kata man sakunda aning mol bebe mi ya markan dorong nga tama wasilol ako hani kabi dorong karandirol be kekanne ami be mol karandi kanne ami be tamala silol minna pour ninga tara nyin courant nata dorong nse tara pare rin dorong ako dulal min nyanta ka soron nga kata nga lom fanan ko masakunda be kata ko be ke kanne pour kaje ko kuwal min nyanta ka lo janning nyin courant alama ala yen tanka futala jan ninga tara fana futala jang abata dorong parita wato yen so nyine lamba fala ya la baraka lamo nyimala nga kacha sendi Dr. Shamila.
So thank you very much, viewers. We have come to the end of the program. From what we have heard from Dr. Desta and Dr. Biteye, the fact that the disease was declared a pandemic is not a cause for us to panic, and the strategies for the virus remains the same. And like has demonstrated by Dr. Desta and also alluded to by Dr. Biteye, these are the only strategies that we have, and they are very effective strategies. But we need to do these strategies in combination. So not just the hand washing alone or the cough etiquette alone or the social distancing alone. We have to do them all together. And I think all of us, if we adhere to these strategies, I think we will be able to contain and not allow this virus to spread. In case we have a case, we'll be able to contain it. And I think we'll be able to do it because it has been clearly demonstrated in many other countries. Thank you very much for listening, dear viewers. Until we have another episode. Thank you. Bye.